socialization, even if it's some physical assertion groups we've talked about. We have a grant that I had talked to Jen about that we're looking at, that we were thinking about sending in to see if we could get some coordination from outside sources as well to come in and provide some of like the physical therapy pieces for some of the residents.
Anybody on the committee have a question? Anybody on the council have a question? I think it's phenomenal.
Thank you.
It sounds like, what I hear is that it sounds, well, I guess maybe I should ask the question, but it sounds like it's a real collaboration. It doesn't sound like there's any turf issues going on.
No, there's not.
It sounds like it's like, let's all work together, which is lovely, because a lot of times somebody like you comes in and they go, well, that's my, you know, so none of that.
And in the very beginning, that's what we were, you know, you're always leery of that, but we made it from this very start. We walked around, we shadowed, we made our faces very well known in the building, and really just, you know, shared with the social workers and the nursing staff that we're not here to step on toes. We're not here to take over what you do. We're not here how to tell you to do it differently or better. We're just here to provide the additional support. And I know the social workers and the nursing staff really appreciate it, because a lot of times they're overwhelmed and you have 3 residents that are all yelling for the same thing, and then we can send a peer support up to take one of them off the grounds or to take one of them downstairs to see a concert, and it really helps some of the other workers out too with kind of the overwhelming, you know, overload they have with some of the residents all at once. We have one tower where we have 9 different residents. So even if 1 or 2 of my staff go in there, it's definitely help that they're providing to the staff that are on the unit. So it's been great. Like I said, I talk to the social workers every day. We email each other. We talk to each other. The nursing staff reaches out whenever they need anything. We check in with them every day per resident that we see. So when we go to the floor, the first thing we do is say, do you have any reports? How is so-and-so doing? Anything happened since we saw them yesterday or the day before? We also have a running log where we can look up information if a charge nurse or one of the nurses isn't available, to find out what had happened the night or 2 nights prior. So that's been wonderful. The social workers are great. If someone gets sick, if they're hospitalized for any reason, they will email me or call me and let me know what's going on within an hour turnaround. So it really has been a wonderful collaboration. And like I said, it's one of those things where we walked in with 7 residents, and now you walk through and, you know, residents are just, we come onto a floor, and if we have 9 residents, to see 4 of them yelling, "Are you coming to see me now?" is absolutely wonderful, and you don't have enough hands sometimes to see them all at the same time, but it's just a very heartwarming experience that we've all had with these residents and the staff at Graysdale.
And I guess the only other question, like in terms of forward planning, does Haven House take the lead on that? Again, is that also a collaboration? Like already you're saying, well, we need more staff, or what about this? So do you just handle that and then present
been a
to
collaboration. Yes. Like once we found out that we got the additional support, I reached out to Jen. I also reached out to the social workers to say, here's where we're at, here's what we can take. Because the social workers have been very wonderful with making sure that we're not overwhelmed and we didn't get to a number where we can't provide the support and the therapy that we want to and we need to because the staff are overloaded. So that's been a collaboration as well. So everyone was made aware of that, and then as referrals come, we, you know, work on the hiring of the new staff. Like I said, right now we're kind of at that number where staff are reaching where they still have a little bit more leeway, but pretty soon we would need additional staff to meet the needs of the residents right now.
And, one quick question. This is a wonderful program. Could you break down what your funding sources are? And are you charged to Graysdale as part of their budget?
I'm going to let...
Okay.
Do you want the answer now?
Sure.
Maybe.
For 2019, almost positive it was split 50-50 from Graysdale and our mental health division. And for in the proposed budget for next year, it is probably 2/3 Graysdale and 1/3 mental health, since we were increasing services. That just is where there was more wiggle room in the budget. So.
And what's the total?
Oh, I do. It was I want to say it was close to $300,000 for this year, but I'm not sure. Part of that was startup costs. So I believe for next year it's closer to 400, but maybe not quite that high. And there was something else, and it went right out.
Okay. And part of it is from state monies as well. So-
Yes, so the mental health funding is the state funding, and the reason, is there's more money next year in Graysdale's budget than the mental health budget, which is, in wanting to expand it, there just was more availability there. And the thought I had that escaped me came back, and that is, the ultimate goal is to work on getting this transitioned to a Magellan or health insurance funded
Okay.
service. But because of that, if we can get to that place, then we can really expand and not even just be in Graysdale, but be in other homes too. We know we need at least probably 2 years worth of services and data to make that pitch. But Magellan, for example, is aware of the program, so they sort of have it in their pipeline that might be coming down someday. But at the moment, because it's not insurance funded, there's total flexibility, and the Haven House folks can spend 5 minutes with somebody, or they can spend an hour with somebody, and it doesn't matter. So ideally, we would figure out some sort of mechanism to maintain some of that flexibility if it was insurance funded.
Thank you.
Yep.
Thank you. Thank you both.
Thank you.
Thank you. And how do you feel rising to the challenge? I want to commend you on being willing to take Deb Nunes's call and make it happen.
I am thrilled to, just to be able to offer this to the community, to make the difference in the folks at Graysdale. Not only for the residents, but also for the staff to understand that, they need help, and this is a mechanism in which to help everyone. So it feels pretty good.
Good. Thank you. I have questions for the Graysdale staff on it, but I'll wait till they come up.
Do you want to ask them Haven House questions, or you just want to wait?
Yeah, I do. Actually, I don't have one. I'm curious to know from the Graysdale end of things how the staff is responding and what you think the staff is learning that they didn't have, like what skill set is being developed, because obviously it's taken off, so.
A lot of the situations that occur is when you have a dementia patient and they're acting out, or you may have somebody with mental health crises. Instead of trying to call crisis right away, which takes time, the group has taught them how to interact with the resident. What are the fundamental things you should be doing or not doing? Not crowding, not give them space. So Haven House has been able to interact with the staff and say, no, don't do that, or do this. This is a great way to train. So it's supportive, which is great. Able to give them the tools that they need.
Okay, thanks.
I was having a conversation this morning with Gary Rushman, our director of IRIS, about the Haven House folks, and I don't have data yet. We'll work on compiling that, but the feel is that there are less phone calls from Graysdale staff. And one of the things that I liked most about this program when Kathy pitched it was it's not just a service for the residents, and I've said this here probably almost a half a dozen times. It's just as much, almost as much for the staff as it is for the residents. And so, if you think about the staff that are working with 75 folks and 150 next year, that's an awful lot of time in that building and with staff. And even though the psychiatrist is only coming in monthly, that's a daily basis, 5 days a week, where there are mental health professionals modeling different interventions with some of our most challenging residents. And certainly the anxiety and depression are probably top of the list given the population and the setting. So I have heard nothing but positive feedback. I keep waiting for one, well, if only, or but. However, that has not come. So I think the other piece that I really like is that with the Haven House staff there, with some of the more difficult residents, when they are able to assist, that means that the nursing staff has more time to complete their nursing duties. And so, whereas if you have a challenging resident behaviorally, if the nursing staff is continually having to intervene with that particular resident, that's taking time away from other folks. And so And especially as we double our number of folks that we can serve towards the end of the year and into next year, I only expect that to continue to get better and allow the nursing staff, again, even more time to meet their other needs. So pretty excited about that. Ultimately, it is our goal to have Haven House help with some of the med management, even if it's for their folks. It just makes sense from a continuum of care perspective. Any Lori, Ms. Fargo Hefner, any final questions about that? Okay.
It's pretty comprehensive.
Good. We'll continue to report back on that, but it is certainly exciting. Our Health Choices program just got approved for one of their reinvestment programs for just over $500,000 for respite services, and that will primarily, it's a 5-year plan, so about $100,000 a year for youth with intellectual disabilities or dual diagnoses. So especially for those youth who are able to remain with their birth families, not children and youth involved, but just folks in the community. Some of these youth that are more challenging, in order for them to remain in home care as opposed to in out-of-home care, the ability to offer pre-planned and thoughtfully planned respite, and we're doing that through access services. That's a population of youth that Access has long been involved with, even prior to them getting into foster care services. So we were really excited about that. So that is scheduled to start, I think the contracts were just finalized or are in the process of being finalized. So I had sent Ms. Zembo the centenarian luncheon invitation. So for anybody who hasn't gotten it yet, it is, let me just make sure I get it right.
Go, we'll feel young.
It is on October 3rd, 11:30 at Green Pond Country Club. So you are all invited to attend. They also asked about our Human Services Committee chairwoman, so you are all invited. So if anybody doesn't, if you need that again, or if anybody didn't get it, let me know and we can get that to you. We had our grand opening of the Oasis Center, and that is an acronym for something that I can't remember, but it is, I think we talked about this here, it's off of 5, 12, and 22, and Rhonda Miller, who is the executive director of Speak Up for Ben. Ben was her son who she lost to addiction a few years ago. She wanted to open a recovery center for family members who have lost a loved one to addiction, or down the road, other stigmatized loss, such as suicide deaths. So that kickoff was at the end of June, and it was very well attended. Rhonda has this ability to just rally the community, and is just such a dynamic person. People can't help but sort of jump on board with her. And before the doors ever opened, she had already. She has a ton of volunteers, but she already had 14 volunteers who went through the, I believe it was the peer specialist training to offer support services at the Oasis. So they're going to be offering all sorts of groups. And when Rhonda talked at the grand opening, she said, when you're the family member who's lost a loved one, or you haven't lost a loved one yet, but they are in the throes of addiction, you forget how to live. You forget how to be your own person. And so they're doing cooking classes and yoga classes and all sorts of things. But it is amazing the amount of volunteers that she has gotten on board. And we have been able to use her as a prime example for all of our recovery centers in terms of building up their volunteer capacity. And the other volunteer, or the recovery centers do as well. But
how many do we have now?
Recovery centers? Yes.
And
So,
where are they?
oh, that is a quiz.
Bethlehem,
Bethlehem.
Easton, Bangor, Northampton, and this one.
There you go.
Do I get a prize?
Sure. Thank
I
you.
better know.
And on that note, the Northampton.
Can I ask a question, though, about
Sure.
this? And I think you said it, but it's definitely a facility that's open to family members who will have addicts who are not deceased, that they're
Yep.
dealing with active addiction, whether in the home or out, that they need
Absolutely.
that support.
Absolutely. Yep. And if anybody is interested in seeing what kind of groups and activities she's providing, we can get you a copy of the, she has monthly calendars printed out. She had them for July, August, and September. So if anybody is interested, we can certainly let you know.
Oh.
Yes, Mr. Hacker.
The Oasis opening, when was that?
June 28th. I
Did
think.
council get a notice of that to attend? We wanted,
It looks like maybe not.
No, I think
My
we
apologies.
might have. I don't remember.
I don't remember. No, just when things, events occur like that, I mean, sometimes they'll go, chair people sometimes go. It would be good to know. Maybe we did. I honestly don't remember. I just,
Yes,
Oh, no,
June.
it
I
already
remember
happened.
mentioning it, but I don't know if we got an actual email.
You might, we talked about it here, but I did not I don't necessarily recall sending a specific invitation, so I
yeah,
apologize, Mr.
read about it in
Johnson.
the paper, but I was just curious.
Sure.
It's often we get invitations, but
You should have.
that's all right.
My apologies.
I'm not on that committee. The invitation committee.
I'm not in charge of that either, clearly.
Uh-oh.
The Northampton Recovery Center, I had it on my list for last month and didn't get to it. They were in the a local kind of press up in Northampton a couple months ago for highlighting all of the great things about it. But one of the things that the folks who attended were doing had something to do with the community day and volunteer service in the borough of Northampton. And despite a lot of initial resistance over us locating a recovery center there, since there were no addicts in Northampton, folks have really come to appreciate the fact that we are there and the services for the folks, and so it's been very well received. So it's nice to see those things getting positive press as well, and they're giving back. They're giving back too, which is nice. I wanted to talk about the vacancies we have in children and youth and civil service, because I've talked in not too many months past about things getting better with civil service, but I jinxed it. So I just wanted to give you some examples of the issues that we are having. We obviously are practically always hiring in children and youth, and so we had 5 caseworker positions that we were trying to fill in children and youth a few months ago, and it took somewhere between 2 and 3 months for civil service to get us the list of names. And that list of names for 5 open positions had 3 people on it. And early intervention had 2 open caseworker positions that shared the list, and Lehigh County shares the list. Any county can share the list, but obviously Lehigh's the biggest competitor. Just if someone lives in the Lehigh Valley, chances are they'll end up at one or the other county. So it has been slow and frustrating, and difficult to manage when you can't even get a list of names for that kind of time period.
Can I ask what the minimum level of qualification is for that position? Is it bachelor's, master's?
Bachelor's, yep. Some experience preferred. I'm not even sure. I mean, it's an entry-level caseworker position, but a bachelor's degree is required. So for children and youth, as of this morning, we have 13 vacant positions, but I think 2 folks are slated to start, one this coming Monday and the one the next Monday, which would take us down to 11. But we also have 4 folks out on FMLA, and 1 vacancy due to right of return, which actually is not bad, because usually we have more than that, and 1 person out on IFMLA. So they're struggling managing, but obviously that's a challenge with that, and civil service just continues to impede our progress in that area. So that's a frustration.
Sure, I'm sorry.
What's the turnover rate currently in children and youth caseworkers?
I would have to get that for you.
Okay.
I don't think it's any, higher or any lower than normal. I think the average continues to be fairly steady, but I certainly can find out.
Yeah, if you can give me the average. I know it's higher than the other divisions. It probably
Absolutely.
is.
Yeah. I mean, children and youth feeds the rest of the building. In fact, the early intervention positions, the 2 vacancies that we had it was unusual not to fill those internally. So then when you start competing with...
No, that's one recruitment plan that works in the county, is children and youth recruiting for other divisions.
Everybody
That's gone on
else.
for decades.
You know what, that's not going to change, because as long as that's the place with all the openings, that's where people come
No,
in,
until
and
the
then
state makes it a separate category, which I many directors and others in the field have advocated for decades with the state, but the children and youth and family case workers and supervisors should be in its own distinct category. But like most things, Harrisburg hasn't hurt us.
Go figure.
Thank you. So, sorry. You said that civil service continues to impede our progress. What are you implying by that, and can you elaborate on that?
Sure. Because of their structure, which I'm not there, I don't claim to know, internally, the turnaround time is slow, and they are not processing things efficiently or quickly, certainly not quickly. And I'll give you another example of that. When we reached out to civil service for an additional list, so we got through the 3 names, so we called for more. They said they have no more on the list, but they sent us a stack of 70 or 80 partially completed applications, meaning somebody took the test but didn't get a score yet, somebody filled out an application but didn't take the test. There's all sorts of, like, A, B, C, and D, and maybe they completed 2 of those things. So they said, here you go. If you would like to reach out to these 80 people and let them know how to finish the process through civil service, go ahead. So we did.
Isn't that their job?
Yes. But we did it for them because we need that's correct, we need people.
Well,
And
yeah.
The interesting thing is, hang on, I wrote this down. Of that large pile, these numbers are low, but interestingly, 3 of the names on that list we had already hired and were working at children and youth. So their incomplete
awesome.
applications were,
Didn't even matter.
Didn't matter.
Great.
One, after we reached out to them, emailed back and said, no, I got a civil service, I got a score on my test, and here's the email from civil service that they sent me. So also not accurate. And then there was another one that sent us a similar story related to their scoring and the fact that they already had that score. So even their list of 80 that they gave us to do their job for, that list was not accurate. But we did. I think it was Marianne Heck, I almost said Heckman, Marianne Heck, and the fabulous Georgine reached out to all of those folks with the instructions on how to complete that process. So we're hoping that and one of the scores, by the way, on that list was 100.
So is it because civil service is inept, or because they're deficient in the number of employees that they have?
Oh, no, they're not inept. No, the Civil Service Commission has been in disfavor in Harrisburg for a very long time. And when you're disfavored in Harrisburg, you're underfunded, you're understaffed, and they're overwhelmed, and they're serving 67 counties. The fact of the matter is we're not blaming civil service. I want to be very clear about that. Northampton County is not blaming civil service.
Thank you for that clarification.
What we are implying, though, is civil service doesn't work for Northampton County anymore, being in the process.
So what can we do about that? How can we solve that issue? Is that something that we have the power to solve, or is that something that we just have to make a workaround?
We do.
And so what's the path to that solution?
Well, the path is opting out of civil service, which...
And just do it ourselves?
Yes.
Okay. I'm like, let's do it.
Me too. There's an application process to opt out of civil service, and so we have gotten that information from civil service to determine what we have, what we would need.
What are the financial implications of that?
we do not have 100% clarification on whether we would receive additional funding as a result of being out of civil service and those folks not having to help us. But we would certainly need one more HR person to do all of that testing and reviewing of applications. But obviously the upside is certainly significant.
Well, it increases our efficiency here and
Well,
our ability
correct.
to staff.
And we, having the career service regs in place and for so long, honestly, when we looked at that, it probably covers 95% of the requirements of civil service. So we have gotten the message that the civil service folks are interested in counties opting out if they're able to manage it on their own. I think, though, what we were told was they're trying to make that process happen in a year or less. So from the
wow.
time you submit an application to opt out of it, it's, I mean, maybe we could get lucky and it takes 6 months, but it could still take a long time. But so we've been talking internally about what we would need if we were to file that application and be successful.
What do you need from us to be able to do that?
A resolution authorizing.
Oh, let's do it. Thank you.
They had a situation where they had the same problem 6 months to a year.
Mm-hmm.
And we've talked about this for years, civil service problems. And I think it would be a very good move to just, I know we'd have to present our own tests, and we have to get the people to do it, but under the circumstances, the vacancies and the way it's been going, and it hasn't been really positive for our county, I think it's time we pull the trigger on it and say, let's do it.
I think so too.
I think Easton
Miss,
did,
that woman.
the city of Easton did, the firefighters.
When they're done, if you would.
And there's some history, but I'm not part of the committee, but I'm all for whatever the council.
I am not on the committee either, but I am all for it, and I will do whatever is necessary to make it happen.
I thought he was too. You are on the committee.
So you could do it.
Okay.
You had no idea, did you? You're
No, I
just attending
You're always here
because you're
anyway,
so,
Mr.
doing your
Werner.
due diligence. Got it.
what would, I guess the steps would be necessary.
So we're planning on bringing it to you in August?
Yes.
In August,
Awesome.
a formal proposal to you for your consideration, so that then we could complete the application process. We think we know what we need in order to get approved, but the Civil Service Commission must approve it.
Of course.
So,
So we want to make nice with them.
Yes.
In the meantime, yes.
yes.
So I'm very sorry that they're understaffed and underpaid, and we really need to take that load off of them.
I couldn't agree with you.
So, are you
Well
finished?
said.
Okay, no, I didn't want to cut you off.
And even in terms of
Yeah,
the
you are.
testing and scoring, the test, it's my understanding, is no longer an actual test. It's submit your resume and your application with all your education and experience, and the test is, do you have a college degree? This is your score. Do you have experience working with youth? This is your score.
Oh, so it's more like ranking your application.
Which makes much more sense. So, but they still call it a test. So we would certainly need another HR person in Human Services to manage that. And we think one person will be sufficient once that person would be trained. So, yes, we are moving forward and have been trying to gather what we need to make that jump. My counterpart in Bucks County, they've been out of civil service for a while now, and when I reconnected with him in this job, he said, "We got to get you out of civil service."
Okay.
I said, "We
So
would
it's
love
been a
that."
move, like, with other counties
Oh,
as
other
well?
counties have successfully gotten out of civil service. And I think, I mentioned this, a long time ago. Berks County
No, it is not.
is out of civil service, and I asked them last September when I saw somebody, I don't know how many caseworkers they have. I think it's safe to assume that they have at least double the number of our caseworker staff, probably more than that. And I said to one of the supervisors, "How many vacancies do you have?" And she said, 4. 4. So now there's still always going to be some turnover and new staff and needing to be trained and go through all that process, but you will actually have most of your seats full. There's an awful lot of people who would apply to be a caseworker if it was advertised, say, on Indeed, who don't know about civil service and that complicated process. And civil service being understaffed and underfunded doesn't have the resources they need.
Is there anything else?
Yeah.
Oh, okay. Go ahead.
No, on this, when you make this presentation, because I know this has been kicked around before, and what you point out is civil service is a pain in a lot of ways. I believe you there. But before I certainly could support doing this, sometimes if it sounds too good to be true, sometimes it is. I'd like to hear from somebody from one of the other counties that's done it when the presentation's made. I'd like to hear from somebody from public welfare. The point being, we're taking on the responsibility. I get it. They're underfunded, which means, on state lingo, means we want you to fund something that we don't want to do. And fine, we'll get control, and that sounds good, but we also get whatever responsibilities and expenses. You've already mentioned one job. I'd like to know the legal ramifications. I personally, I'm just one council member, but there's a lot involved in this other than a simple resolution. There's financial implications. There are legal implications. I just would like to have all of that presented.
Right.
I mean, I just need to hear that.
No,
I mean, Easterners, it's great other counties do it. It's like block grants. I mean, that's put out there as a savior for the counties. And on the surface, it sounds like a wonderful thing until you get your block grant and you find out over time they're not giving you as much as you need. So I'm just saying, for me, I need more than just it's a great idea. We'll get all our positions filled and it won't be a problem.
No, absolutely. It's been, look, this has been a goal of mine for pretty much since I started, and we've been working a lot in the last few months to even understand what we need. The good thing is civil service gives you a really nice, detailed, this is what you need to get out of civil service. If we didn't have career service regs, Mr. Hackman, this would be a whole different conversation. But the career service regs so similarly mirror the needs that civil service has, that at least we have that structure in place. But Liz Kelly's been actively involved in this as well. So no, we'll have the whole presentation
I think we're going to need a lot of
so.
details and time to study. I'm not speaking for, I need a lot more details and a lot more time to study this, as opposed to just here it is, vote for it.
Well, we will
think it's a good idea.
certainly have all of that information to present in August, and if there's additional questions after that, we're happy to get those answered.
Thank you.
You're welcome.
I just wanted to make a suggestion to tag off of that. Maybe Mr. McGee could set up that as part of a personnel committee meeting, and we could have a presentation from Ms. Kelly and your folks as well. I agree we do need some more information, but I think the appropriate forum would be the personnel committee to go over all of that. So just my thought.
Thank you.
Do you have anything else?
I do not have anything.
In-house?
I have.
What's that?
Anything else in-house, like any other departments or anything that we need to know about?
No, not at the moment.
I have a question on departments.
Go ahead.
Sue, are we doing anything? I know over the years past, the aging, especially now looking at the heat situation and that, where we reach out to the elderly, and not that it would help maybe today, but fans and things. Are we still doing those programs where we do outreach to not only our client base, but we try to get out to let people, elderly in the county, know that if there's a problem, they should get in touch with us? Or
We do, and in fact, it was quite a while
through
ago.
churches and whatever.
Yeah, and the communities, or the senior centers are certainly a wonderful opportunity for us to do that outreach. It was quite a while ago I wandered into one of our storage rooms, and I'm like, what are all these box fans doing in here? Well, that's what they
Is
were
that what they're
So,
for?
yes, so to distribute to folks who maybe
I just
want
wonder if we're still actively doing things like that in the summer, because this looks like it's going to be a rough one.
It absolutely does, especially the next few days. You are correct about that.
Yeah, this Saturday is supposed to be over 100
Yes.
degrees with the
Oh.
heat index of 107.
Check on your neighbors, stay hydrated, go to your libraries, malls. Someone suggested the casino, open 24/7.
Everybody.
You don't have to gamble.
Everybody.
Right.
Just stay air
Start
conditioned.
more addictions. There you go.
Check your neighbors.
Stay cool, start a new
Please.
addiction. Sounds good. You ready
That's
for
it.
Graysdale?
Sure.
Sounds good. Thank you.
Bring it.
Working on it.
Thank you. If there's one thing I'm going to go on down in history for is please have larger print. I'm sad to say that publicly, but it's true. My little eyes.
Good evening.
And I have
So we
progressives, that's bad.
have the dashboard for Graysdale. And as we go through it, I'll bring up different things that we're doing at Graysdale as a whole. So we can look at the first line, which is about our census. So 645 was the monthly census for June. So we continue to do the marketing. Mike Colon and I are working on a game plan. We're reaching out to media to do radio, television, billboards. We do placemats, newspaper, Facebook. And this kind of parallels to the recruitment efforts we've done for staffing. So wherever we reach out for residents, we also reach out the same way, a little differently, for employment opportunities. So again, for the recruitment employment, we again hit the placemats. We do the focus for the northern part of the county. We've done morning call. We've done job workshops. We've done Facebook. We do Indeed. I know for the employment, we've done the colleges. So we've reached out to NAC. We just met with the school over their graduates of the LPN program in August. So again, it parallels the recruitment efforts we're doing in the admissions department. We're getting out to, we're going to be making appointments with the senior centers. We're reaching out to the hospitals. We are doing just across the board, talking to case managers, finding out what's going on with sending us admissions. We've had quite a few admissions that have been set up on a Friday to come to us. They're ready to come Monday or even on the weekend, and they don't come. And these are people who were volunteers for us, and all of a sudden the case managers tell us, well, they changed their mind. Well, what happened from Friday to Monday? Let us know.
Can
And
I
where did
interrupt
it
you
go?
for a minute and
Absolutely.
ask since we're looking at the year-to-date, what's the benchmark number that you'd like to see for average? Like, what are we comparing it to?
We're budgeted for 660, but
Okay,
I
thank
look
you.
at 670.
Thanks.
So we continue to reach out, find out when families come in. We're asking them what they like about the place. Somebody brought up the fact that they thought the rehab was a little far from the entrance, but if you come in for rehab, it's right on the unit where you're going to be staying, so it's not too far from where you're at. For the recruitment efforts, again, for the job part, we're looking at NAC. We spoke with Falcon, which is a nursing school that comes in, and they actually do their rotations like NAC, where they come in, they do their geriatric rotation. So I know I meet with them, and Dawn meets with them and say, hey, you're trying your rotation here. If you like us, please stay with us. Come for interviews. We've reached out to Penn State, L-Tri-C, CIT. We're rounding on the units. We're asking staff. We're reminding them that we have a reimbursement program to advance their careers, and as well as if they know anybody who needs jobs. We're in the process of sending out postcards to LPNs and RNs in a 30-mile radius, just saying, hey, we have openings. Call us if interested. Come see us. Talk to our staff. It's like I told Dawn when she was hired, just come try us out. You'll fall in love with us. We're in the church bulletins in 5 local churches. We're also reaching out from the admission standpoint to the churches to see if we can do some kind of in-service educational program on what to expect when you come into a nursing home. Nobody knows what to expect, and families come in and they're so overwhelmed, so why not have those conversations at the churches? During interview process, Dawn and her team, they all talk about, do you have anybody else that might need a job? Come on in. We talk to the new recruits. I meet with all the new recruits, so when I meet with them, I talk about how, there's challenges here, but it's a great atmosphere to work with. And there's also advancement. So if you're a CNA, you can move on to an LPN, you can become an RN. If you have family members that aren't sure, you have children who aren't sure what they want to do with college, come on in as a CNA, see what it's like to be in the nursing field. So come. So we reach out in every aspect for not only employees, but for the family members of somebody who might have to put somebody into Graysdale. We get so many compliments from the families that do come into Graysdale, how great it is, how attentive the staff is. Haven House has helped with that. As you heard, the referrals come from now family members. I know 2 nursing homes have reached out to Haven House to recruit them onto their company. So we do have a game plan as far as the marketing and getting our census up.
Can I ask another question?
Absolutely.
Is it seasonal as well? This sounds silly, but
No, it's
you know,
true.
nobody goes to rehab in June, July, and August. So is it similar for nursing homes, or is it?
It is. It is. It's nicer weather. You're not seeing the flu. You're not seeing the slip and falls. You're not seeing the things that come fall, winter that you see during the summertime. And there's a lot of people who feel guilty about putting people in a nursing home during the summer months when it's nice. So we have many families come in and they sign all the paperwork and they just say, well, we'll see you in September, or we'll see you in October. So then you can see the hours per patient care per day, so that's 3.44. The cost per resident day, in May it was up at $905, and that is because we made that IGT payment. But if you look at our Medicare rates, we had a higher Medicare rate because the people we were bringing in for short-term rehab, was a higher case mix. That was a good thing. So you can see we had 114 inquiries into the admissions department. That translated into 31 admissions, but there were 41 discharges. So that is good and bad for us. Good on the short-term rehab. We want them to go home because it looks good for our numbers. But then again, you have to work harder to get more people in. So it's a catch-22. Agency costs, again, usually go up in the summertime with all of the vacations. So we are continuing to work on that so we can get it down. Of the new nursing aid class, there were 14 of them, and we hired 14.
Mm-hmm.
Then you can, anything I can do. Staffing again. So we remain to be staffing in all departments. We're looking at every avenue, but we are seeing the applications come in. So we are very lucky in that aspect of it. You can see the call-offs for June. The total call-offs were 481, 7 IFMLAs, 117, IMLAs are 7, and IFMLs are 127. So that's 28%.
Can I ask a
Yes, I'm
question
sorry.
there?
I'm looking at numbers. I thought.
Yeah, the executive raised this issue at our last council meeting, and I did notice there was an advertisement for a leave administrator position in HR. Is that related to this issue, or how have you approached this since the executive addressed us last couple weeks ago?
It's the correct, right. So it's just Tanya's position, who used to be the leave administrator. So it's not right. It's
Is she
not a
still
new
there?
position. She's not.
So it was. I saw the position advertised, and I was scratching my head because I did recall that the executive spoke about it at length. So will that position address
Yes.
this issue?
Yes.
Okay.
Mm-hmm.
Can I ask a question? So I just want to follow up on that. The position that you're talking about is the doctor reviewing the
Oh, no,
that was
no,
a
no.
policy that you had discussed last time, too. Have you implemented that?
The leave administrator is a current position. That's not new. The incumbent moved on to another employer, so we're filling that. But that person did do the Graysdale FMLA and IFMLA. So we are sort of seeing that as an opportunity to maybe educate the person, the
I
new
see what you're
person
saying.
in that job as to what the law is, because, we've got to be very careful with that, because remember, we want people to take FMLA that need it, right? But we also, this person also needs to be trained so that they can investigate the possibility of misuse of IFMLA and FMLA. So it's an opportunity. I have also been talking with Ms. Kelly about coming to you with a potential proposal for an additional person to just work Graysdale leave requests. But we haven't sort of figured that all out yet, to the point where we could come to you and ask for you to create an additional position. We are hoping with the hiring of occupational medicine physicians to review FMLA and IFMLA claims, that will get this problem under control.
Did you do that already?
It's
though?
done.
That's what I was asking. Yeah, okay, so that's done.
It's done.
The mandate system still in place?
Yes.
And has it been altered in any way?
I don't know what you mean by altered. We're using the, and Don can speak to this, I think, with more accuracy, so you might want to put that question to her. But we're using, my understanding is we're using a regime that we worked out with the labor unions there. But she could speak to that more directly than I can. Yeah.
Can I ask, do you want her to finish the dashboard before we take this opportunity, or would you like to?
I'll wait the dashboard out.
Well, why don't we do this? Is there anything that's super pressing on the dashboard that really needs to be highlighted? Because I don't want to double back. I'd rather.
You probably want to find out about wounds involved.
Well, 'cause
We can just do,
and then I have a note to go back to it. Thanks.
so you can see the wounds. We were up in May, but we've come back down to 54 wounds, and that's total in all of Graysdale. So there are people with multiple wounds. So it's a positive thing. We're trending in the right direction. Reportable infections, you can see there. But I wanted to get to the falls. So we have a new falls program in place, and I'm hopefully going to look in the fall to tell you about the falls program.
Falling into fall. Okay.
But right now, we've fallen, you can see, from 178 in May to 145. So we've looked at different avenues, trying different things. We're actually categorizing falls differently. So behavior versus a true fall. So we're looking at those, and that's where we see a lot of the decline in them.
And that's in line with the state mandate and regulations?
Mm-hmm.
Why wasn't that happening before?
We were looking at different things. We had people who were in from a hospital setting. So in hospitals, a fall is a fall, no matter what happens. If you change any kind of plateau, if you're in the bed, if you
Level.
go to the floor, if you're in a low-rise bed, that's a fall. There are people, we had somebody who has a care plan to say, I like to sit on the floor. So the nursing was saying, well, that's a fall. No,
What?
it's somebody who likes to sit on the floor.
Of traffic.
So we had to clarify all that with the Department of Health.
Can I ask a question? Gentlemen, excuse me.
Yes, yes.
The expired or discharged, and I see you have it parentheses, I guess that means a minus. I mean, I just didn't know, we know they expired, so I was just curious about the parentheses. Do we, when you say expired or discharged, do we break that out? Like who, because there's a reason they would be discharged, right, as opposed to expired? Or are you saying they expired, therefore they're discharged?
No, it's expired or maybe discharged home, or.
I'd be curious what of the two. I mean, I don't know if that's needed for anybody, but I'm curious about it.
We can divide it out.
I was just curious
It's not
because of
about the wound, it's about the person.
parentheses. I didn't understand why it's like in parentheses. Maybe I'm missing something.
Total wounds minus the ones that are healed, minus the ones that were expired or discharged equals ending active wounds for the month.
Oh, so it's math. Okay.
It's math.
It's just math.
There is math in social
I didn't know
work,
human
and it's very
services was
limited,
getting
but it's
into
very
math.
important.
That's a new area for them.
And this is good math. This
Yes.
is,
A bridge is a bridge.
There's a bridge, you know. We had one person we'd hire who was a math genius in human services, and everybody else just didn't try it. They funneled everything through her, so. All right, I see what you're saying. You're
now that
subtracting
we're
from the
clear.
total. Well, no, I'm clear now, but yeah, the expired or discharged, I don't know. I just think that would be interesting to know.
How many actually?
Yeah,
passed
Who died,
who
who
expired
left.
and who discharged.
Okay.
But,
looks like infections are down again.
Mm-hmm. And again, summer
Incident
months
reports are down.
Yep.
And so, some positive trends, right?
Yes.
And then the quality measures?
So we decided to take a new look on this. So a lot of times we focus in on some of the things that we need to improve. But what we did was also highlight some of the things we do better in. So there are 7 green tabs that show you how we do better than the state average. So we continue to do our reds and try to focus in on the moderate to severe pains, the long-term moderate to severe pains. We are working on that with the doctors to try to work things out, whether it's routine pain medication, meaning ibuprofen or Tylenol, something like that. We are working with the doctors on that, trying to work that. And then again, you have the antipsychotic medication, which we've got accolades to say it's coming down, but given our population, it's a tough call.
And again, is there a way to check if they're coming in on that medication? And that's why, because it says long-term, so they're coming in with that script for that reason.
And again, as some diagnoses get exacerbated after a while. So you're looking at dementia, it progresses.
Okay, there, no, I'm not going to use it. May I ask a question?
Yes, please, please.
The inspections is different. We anticipate one coming up here shortly.
They come in on complaints now. We're not due for our annual survey until later in the fall, winter time.
So we're not looking to have any surprise attacks.
That's November usually.
Right. And they did that a little earlier. Usually we're in December, January. Yeah.
I guess I'm saying,
We don't anticipate any.
okay, all
Right. You never know.
right, just in case.
Right. We get the phone calls. Yeah.
Are we drilling?
Absolutely.
I'm looking at Dawn. Are we drilling? Are we practice running?
Okay, so then the follow-up question is, okay, we have all these recruitment programs, we're doing all these things, we hired 14 what?
CNAs.
CNAs.
Mhm.
Okay. Overall, have we hired, how are we doing on the other areas? Are we bringing, how many new people?
Well, I will leave that to Dawn.
No, that's
please.
all, that's good. I can-
Yes.
I can break-
Segue.
It's a segue.
And you could have your other,
I can ask that.
and you can ask your mandate. Sorry, but thank you
Hello,
for waiting.
Okay.
I'm going to wait until you
Regarding mandations, we've been working with the unions. There, at one point, was some disconnect between what we had discussed at the meeting and what we actually practiced. That has now since been resolved. We've had a lot of new supervisors in those roles, and a lot of new folks coming and going. So now that we've stabilized there, we have definitely gone down. The union, we spoke with them, we asked them, what did they want? They wanted less mandation. We said that would equal some less people on the units, because you can't really have it both ways. We can't mandate to keep people up there and then, still have that. So the mandations in April were 4, in May were 13, June was 5, and July was 1.
And that has come down considerably.
Correct.
What was June again? Sorry.
June, 5.
And July is to date is 1.
So we're still in compliance with the act, correct?
Absolutely.
And we were able to work within the confines of the union and the needs that the people were asking for, so that there was not a morale problem.
Well, no. Because people always want more. They always want more
Yeah,
help.
but by throwing out an olive branch and working.
Absolutely.
I'm sure that must have had a positive effect.
Oh, absolutely, yes. To most people, yes, the ones who always want more help, will never be able to please them, but we are doing everything we can to work with the union as a united front. We even have union members that are definitely, you're doing the right thing, and we're out there telling our peers that you can't have no mandations but the same staff, so it's.
Is are you gaining any kind of parity with the fact that there are people who take the extra hours all the time and that they get tired, and that you can alleviate some of that for them somehow? Is there a time period that you can give them off versus others?
We make deals.
You make deals.
Like if we need somebody on Wednesday and we, you know, they're working Thursday, we'll say, you know, like, make a deal. Can you take off that day and come on this day? So we make deals. We ask for any volunteers, like 4 hours, 2 hours. And
You've opened this up quite a bit.
yeah, and we.
Well, I'm being honest with you. What I've mandated is pretty solid, straightforward.
Correct.
And that has sometimes an adverse effect on
Correct.
when you mandate things. But when you offer something along with that mandate,
Mhm.
put a little butter on it.
Right. Right.
Okay, now that we're cooking,
Okay, so it's butter. With butter, yeah. Or margarine, it depends on what you use. But, okay, so that has improved. I like that, didn't you? But there are still people who are always asking for the extra hour.
Correct. Oh, gosh, yeah.
And so we've got a plan in place.
Get
right
that
now.
pension.
Pardon?
No, I'm just saying, make that pension higher.
Yes. Okay. That's fine. If it's working, it's fine.
So far.
I was just curious because when I first approached the mandate problem,
Mhm.
it sounded like there wasn't much flexibility.
Correct.
Sounds like that's changed.
Correct. We are definitely on a more positive swing.
and you had a second question, or
No,
we were gonna,
it was about marker. I don't know about that.
oh, no, it was about hiring and the numbers.
There will be dates. I mean,
Realistically.
Yeah, really, you can't pretend there won't be dates.
Of course. We have a
Done with this
threshold
or not?
that we have to.
When they're done.
It's gonna happen.
Right.
That's not-
Well,
Let's
it's never
get
the
food.
holiday, 'cause it's always the
Yeah,
day
it's
before
about
the
this,
day.
but I'm waiting.
Okay,
That's
I
a good-
understand that that's gonna occur every once in a while. That's not unreasonable. What I was more concerned with was when this first came out about the mandate,
Mhm.
it seemed like there was a tremendous amount of pushback and it may have caused
Correct.
further problems.
And again, we're very grateful to the union. We're working, you know, side by side with them, hand in hand, and we're really trying to move forward together.
I thought that there was a question about the CNAs and the recruitment issue. You were good?
No, actually, that all plays into that. They're all part of that, so
Okay.
that's fine. Thank you.
Any other,
Telling me I'm-
you're welcome. I always encourage that. You had one more question, or wait?
I didn't know if she was.
Do you have any other report or information for us
I
that
had
we
a
need to say,
question on the
Dawn?
long-term
Whatever you
part.
want to ask.
Okay,
ahead.
2 questions. I see that our physical restraints, and the only question on that is, I know the state and even Fed, they've come down hard. Where are the regs now on restraint, on physical restraint? I mean, I know they've made it,
Never.
it's a good thing, but at the same time, it creates problems for people like yourselves in a nursing home because of certain cases.
Correct.
Could you, just give me a thumbnail on?
They don't want us to have them, but they understand that if we need to, there is.
Do you have to do special documentation or
Correct.
excessive documentation?
Absolutely, right.
Okay, but I mean, and part of this will lead into my second question, because I always think of the nature of the folks we get at Graysdale and the long-term nature of their medical condition overall. And we may be in a position where restraints become more necessary than in, let's say, some other private home at times. The other question then would go on the high. I was looking at your numbers as opposed to the state and national averages, and I saw that the one self-reported pain, moderate to severe long-term, is the averages are around 6.5. We're at 12.1, and what's that? Can you help me there? Why are we so high?
It's all in when you're asking and how you're asking. This is something that we're talking to the doctors about to address. So when you're talking about the pain, an RNAC, which is a nurse that does an MDS to get our payment, will go in and they have to talk to people and ask them, So, in the last 2 weeks, have you had pain? How would you answer? Have you ever had pain in 2 weeks?
I've got a lot of pain.
There you go.
lot of
That's,
places.
you're the skewing the curve at
I'm in pain
Greystale.
sitting right here sometimes, but,
But that's the problem.
yeah.
So there are nursing homes that do, right before the MDSs, they start the pain medication. We don't.
Is
Okay.
there not a continuum at all? Like, isn't there like, on a scale of 1 to 10, what would you say your pain level is?
Yes, it is. But some of the other questions, so they have the scale, but the other question is any pain. How would you rate your pain? Well, somebody who has arthritis, who may be sitting down, or maybe has a
Today
bad
would be a
cold,
bad
is
day.
going to score higher because it's pain.
Seems kind of
But they're all self-report data, so that's why they're high, right?
Right.
And it's
Of
our
course,
population.
yeah.
Right.
Everybody has a different threshold of pain tolerance.
Point out, when you talk about pain, and that question is asked.
Right.
What's your pain level from 0 to 10? I know that's asked all the time. And there are people who say 8 all the time, or 10 all the time, no matter what they're. That's just the way it is.
You were starting to explain about how other nursing homes report their pain?
Right, so, we talked to other nursing homes, and we're trying to find out how their QMs or their 5 stars on these things. Oh, well, if you start the pain medication 7 days before your MDS is due, you may not have all that pain.
I thought you were supposed to keep that kind of medication down, though, like.
But it's
We are.
short term. It's only for 7 days.
Really? Wow.
But we
Welcome
don't do
to the world of numbers.
Well, that's good.
Right, so
Like
that's
this,
why I
right?
say, our QMs, yes, does it get us in trouble, but we're very truthful.
so when the
Because
doctor,
it's all self-reporting.
so in the pain thing, when the doctor scripts and has said, this person would be eligible for pain medication over this period of time, then it's the RN's call. Like, for example, the only person then who can say, okay, now administer the pain medication, if the doctor says when needed, I've
Right.
talked to this,
If you do
only
PRN,
then after that, only an RN can approve it.
A nurse.
Well-
Right, LPN can also.
Oh, an LPN can
ask
also
for
do
a
it?
pain level, because there's always parameters. If I say you give 2 Tylenol, if your pain is at level 3 to 5.
Right.
Then you're gonna give 2 Tylenol, because there's a very direct order, so an
Yeah.
LPN can do that, so it doesn't have to be an RN.
Oh, okay, so an LPN can do that. Does the LPN, for example, may say to an NA, would you please go and do that, or does the LPN have to do it personally?
Oh, no, it has to be a nurse. Has to be
Okay,
an LPN or
that's what I was driving, I mean, as much as we get beat up, I know that that's happened I've been through the mill on nursing homes privately and publicly. That does happen at places. I mean, they claim it doesn't, but I've seen it with my own eyes. I'm glad that we're doing that.
An aide can ask, like, if I'm in there.
Oh,
giving
yeah, no,
her
I understand
some
that.
Water, then, she can say, oh, I'm in pain, and then go tell the nurse.
Yeah. And the last question I'm following up on that, and I think that probably ties into the bigger issue we're talking about. On residents who received any psychotic medication long-term, the average is around 14.5, 15. We're at 21.5, basically. And on depressive symptoms, we're actually down, which I was surprised about, to be honest with you. But so I would guess that the antipsychotic medication, the reason we're up is because of the nature, again, of the people that we're dealing with. Would that be a fair estimate?
Correct, and it's definitely our population.
Can Haven House address chronic pain clients within the realm of how it affects them psychologically? Is that a possibility?
It's med options, has to go through any kind of med management.
I'm not talking about the med, but just in terms of perception, and can they do some psychoeducation on that? Because would that help to?
It does, and the doctors are on board with Haven House, so they will listen. If they write in their notes, hey, you might want to look at this. Absolutely, the doctors will look at it.
Are we still tracking medication, the data on the floors? We were supposed to have a program that was tracking.
Like the gradual reduction?
Yes.
Yes, we do that. Absolutely, our pharmacy is on board. Yes.
Because I think that would be
Right, and they speak with the doctor and they'll say,
And why are you doing this?
exactly. And there's one group that definitely, let's start reducing them, and, you'll always meet some resistance, but for the most part,
I thought those systems were supposed to reduce recycling problems.
It is.
Is that correct?
Yes, so if they do reduce it though, and there's an adverse effect to it, they have to go back to it. So we try it and see the outcome. But when you're talking antipsychotic medication and people have been on it a very long time, it's very hard to get off without then the behaviors coming through. Then you're calling Haven and Crisis and everybody and their brother to help us. Absolutely.
You have a question? I'm hitting close to 10 on, so go ahead.
Can you use medical marijuana there?
No, no.
Sorry.
There's a can of
Interesting
worms to
question.
open at the
I
end of
just,
the day. No, that's an
At-
interesting
You're the
question.
first, Mr. Kusick. I was.
Is that a legal,
No.
it's a regulation rather?
Well, because there has been discussion that it's a potential alternative to these types of drugs.
Correct.
So I just thought I'd ask when the discussion went that
That's
direction.
interesting. I would guess, and if I may, John, I would think, because we're still in that gray area, because I know people, we get a lot of federal money for nursing homes, and the feds still claim it's illegal,
Right.
even though how many states now are doing it. But no, I hear you. I mean, look, I
CBD
have
oil.
people coming up to me and say, is it true the county's allowing you to have medical marijuana? And I'm like, we're not in the business yet, at least, so go see someone else.
Yes, but at this point, no. We discuss it at PACA, and we know it's coming, but no, we are not doing that.
Well,
And
but
Fed
then-
supersedes
well, then my
state,
follow-up, what if somebody is using it and then they are admitted? Would they have to come off of it?
We don't accept.
Okay.
Oh, you don't
We haven't come
accept?
across that yet.
Right. I think
Wow.
maybe once or twice, but it's still,
All the workers will be happier.
Sorry.
Mr. McGee had a question before we close.
It's a little
Are
off
we good?
topic here, but it's on topic with Graysdale, the electronic record system.
yes.
It's on
Can you
topic.
just give a small report on that? I know it's getting close to. the-
Absolutely, I've actually jotted that down. So right now, we are at the conversion stage. So we have point-click care, and we're having all the data from Cantata, which is our existing system, pushed over into point-click care. So we're getting very excited. We're looking forward to this. So training is ongoing. We have our super users being trained. Everybody's excited so far. When they see the new dashboards and they see what's coming. So it's a good thing. We're on target.
Great.
Yeah.
Thank you.
Thank you.
If there's anything else? Yeah, it's a hospital term. I'm having flashbacks to a former hospital job when she says that. It's like the lead teacher. With that, can we have a motion to adjourn, or do we need a
Yeah,
motion?
do it.
Thank you.
Just adjourn.
Take it.
You don't need a motion to adjourn.
I've been paying attention, everybody's been doing.
I know, but just because they're doing it doesn't mean it's right, Bill McGee.
Well, you know what?
All the kids are doing it these